Good evening. The Prime Minister says he is confident the country can defeat the coronavirus as long as everyone takes seriously the government's restrictions and instructions on how to live our lives for the next few months. Boris Johnson said he thought it would take 12 weeks to turn the tide on the virus in the UK. But he said that depended on the public following government advice, social distancing, working from home where possible, and washing our hands. Today, the Bank of England slashed interest rates to an historic low to try to shore up the economy. The number of confirmed cases in the UK rose to 3,269 today, and the death toll now stands at 144. And there was a message today from the Queen. She praised the work of scientists, medical staff and the emergency services, saying the UK was entering a period of great uncertainty. Our political editor, Laura Kuensberg, is in Westminster for us now. Laura.
Sophie, this is still a very precarious situation. The Prime Minister set out a more optimistic message to the country that if everyone does their bit, then perhaps the worst could be passed within 3 months. But there is so much still that we just don't know, so much that the government scientists can't be sure of. There is no clear, guaranteed, certain path through all of this. It's a fight for the health service, a fight for the economy, but a fight for morale and resilience too, with messages tonight from Downing Street, but from Buckingham Palace too.
The Royal Standard lowered, marking the Queen's departure for Windsor Castle, urging the nation at a time of great uncertainty to come together as one, leaving the quiet capital, where the government's frantically trying to manage an unknown future. What is now a regular routine, the Prime Minister talking to the public at 5 o'clock, but no immediate sign of drastic new action today.
We can turn the tide within the next 12 weeks, and I'm absolutely confident that we can send a coronavirus packing in this country, but only if we take the steps, we all take the steps that we have outlined.
You told the country yesterday you wouldn't hesitate to take extra measures. People are worried about what that might mean.
Yes.
Can you tell people what might be next? Will you, within days, seek to shut pubs, cafes, clubs?
As long as we think that people are actually staying away from places where they may transmit or pick up the disease, if we feel that that is working, then we just want to say thank you to everybody for their extraordinary efforts and encourage everybody to do likewise. If we feel that it isn't working, as I said yesterday, and we need to bring forward tougher measures, then of course nothing is ruled out. There is no prospect of us wanting to stop public transport in London or stop the tube or the buses. We're not going to be telling people that under no circumstances, if they really need to go to work, can they go to work.
More limits on our lives would hit some firms hard. The law's been relaxed, though, to make it easier for supermarkets to work together. They say there is just no need for queues like this. But the concerns are real.
Unless we give a guarantee of wages and income to everyone, particularly those who cannot work, then we're all at risk as a result of it. And I don't think the government has sufficiently addressed this.
Minister John Glenn.
Some form of that could come tomorrow, but it's not clear exactly what will come on top of the Treasury's plans.
Any business who needs cash to pay salaries will be able to access a government-backed loan on attractive terms.
You can hear the disquiet. What about people losing jobs now?
If the government does not act immediately, large numbers of people will be unemployed.
And can I urge the government to say something today to give people assurance that the help will come?
Where can they get answers because they are so worried?
Yes. Ministers are putting forward this afternoon a long list of emergency laws, from giving the Home Secretary the power to close the borders if needs be, forcing business to share information about food supply, making it easier for retired doctors to get back to work. This, the coronavirus bill, is an encyclopedia of emergency powers that ministers think they might need to manage the crisis in the coming months.
Huge new powers the state hopes it may never need. But while our landmarks look the same tonight, much about our country does not. Laura Kuensberg, BBC News, Westminster.
Our medical correspondent Fergus Walsh is here. So turning the tide on this virus in 12 weeks, how realistic is that?
Well, if it means that in 12 weeks that infection rates are going down, whereas at the moment they're soaring up, and if it means that within 12 weeks we have medicines which can fight COVID-19, then yes, you could argue that that's turning the tide. But send the virus packing, that really is optimistic. And the Prime Minister's two key scientific advisors will not put any time limit on when the controls on all of our lives can be eased. And those modelling the outbreak for the government say that as soon as you ease restrictions, the virus will simply surge back up again. And no one anywhere in the world has yet devised a convincing exit strategy from this pandemic which will return all our lives to normal.
A lot of people want to know if they have had the virus already. And the Health Secretary said tonight the government's been buying tests today designed to see if that had happened. How does that work?
OK, so what they're looking for is an antibody test. It would be incredibly useful if you could find out whether you have antibodies in your blood and so you're immune from the virus and can't catch it again. Now, the Health Secretary said tonight that a pinprick blood test had gone into production. But earlier, the Chief Medical Officer said he wasn't sure that any of these tests currently work, so we'll have to wait and see. But what everyone agrees is we need more of these swab tests in the community to check who has active infection now. They're being ramped up. 8,000 were done yesterday, but we need more so we can track this pandemic.
Fergus Walsh, thank you. Well, the Queen and the Duke of Edinburgh are both at Windsor Castle tonight. Our royal correspondent Nicholas Witchell joins me now. And Nick, the Queen issued a message of solidarity to the nation before leaving Buckingham Palace this afternoon.
Yes, the Queen left Buckingham Palace this morning, a week earlier than planned. That's precautionary. She's now at Windsor, as you say. She's been joined by the Duke of Edinburgh. He travelled down from Sandringham. They will be there until after Easter. And then this afternoon, Buckingham Palace issued this message from Her Majesty the Queen, a message from the head of state at this moment of exceptional difficulty, asking the country to come together and to act together. She says she's aware that many people in this country and around the world are feeling great concern and great uncertainty as we are all being asked to change our regular routines and normal patterns of behaviour for the greater good and to protect the most vulnerable. She says, at times such as these, I am reminded that our nation's history has been forged by people and communities coming together to work as one. She gives thanks to those on the front line. We are enormously thankful for the expertise and the commitment of our scientists, our medical practitioners and emergency and public services. She then says this, but now more than at any time in our recent past, we all have a vitally important part to play as individuals. We will need to find new ways of staying in touch with each other and making sure that loved ones are safe. She finishes by saying, you can be assured that my family and I stand ready to play our part.
Nick Witchell, thank you. Well, London is proving to be a hotspot for coronavirus. The number of cases and deaths is rising faster in the capital than anywhere else in the UK. The Prime Minister said there's no prospect of the government wanting to stop public transport in London, but he urged everyone to take the advice and restrictions seriously to avoid tighter restrictions. Our home editor Mark Easton has been gauging the mood among Londoners in a quieter city.
The sirens are screaming, stay at home, stay well, protect the NHS. For the most part, London is empty, but not everyone is listening.
If I need to go somewhere, I'm going to go somewhere.
What about other people? You might infect other people.
Well, then they should stay inside them, isn't it?
It's hard to change your habits and routines. The Instagram generation wants to show the world they were there, and the threat is invisible on deserted streets.
I just want to see how busy it was, and it really is very busy indeed.
Yeah, same. I'm his wife, and I'm doing the same. Just taking a look at London and then head back before total isolation, which I think is what's coming next, total lockdown.
It's just been the last of the few days of freedom.
The plea is not to go out to bars, cafes and restaurants, but some people are clinging on to their normal lives in an increasingly abnormal situation.
I live on my own, so I've got no family or anything. It's just me there, and you can have too much of TV, you can have too much of anything. So to get over the road and buy a paper and come in here and have a couple of pints.
At the Regency Cafe, the full English will soon be off. The owner is shutting up shop.
There is very little reason for being open now, and of the risk factor. And people also are frightened, aren't they? Absolutely.
I live on my own. I need a support system. If the Prime Minister says I've got to stay indoors, it looks desperate. It's quite frightening.
London's big shopping streets have been almost abandoned, but neighbourhoods, supermarkets, hairdressers and market stalls were doing brisk business today.
People can feel that life is about to change. They're searching for supplies, they're getting ready.
I'm out to get some vital supplies. I've just filled up my car with petrol. I live on my own, so I've only got myself to rely upon.
Just around the corner from the shoppers, a temporary mortuary is being assembled. A blunt reminder of why some want the politicians to order us to close the door on our social life. Mark Easton, BBC News, London.
Well, interest rates are now at their lowest level in history. The Bank of England slashed them to just 0.1% today. Our economics editor Faisal Islam is with me now. So emergency measures, how much is that going to help?
Yeah, second emergency cut in just over a week. That lowers the cost of borrowing across the economy for those businesses that want to invest. Probably the bigger move is the £200 billion they've announced of government borrowing that the Bank of England will now purchase. How does that help? It lowers those interest rates over 2, 5 and 10 years as well, but also it provides space for the government to borrow a bit more in order to tax a bit less and spend more. I think that's the key difference here. It also means we had some pretty hairy moments in markets yesterday in terms of sterling falling, in terms of the cost of borrowing going up. It helps with that as well. But that space for the government is important. My understanding is negotiations going on into the night with unions and businesses about the details of a wage subsidy package that could be modelled on some of the things we've seen in Europe, where some proportion of people's income might be paid. That 12-week period that the Prime Minister talked about, that might be key.
Faisal, thank you. Well, the government says it is going to look after the people who suffer the economic consequences of the coronavirus. Measures, as Faisal was just saying, will be announced tomorrow. Those on 0 hours contracts and those who work in the gig economy are particularly vulnerable. Here's Sarah Corker.
Demand for rides has plummeted as Britons self-isolate. Uber drivers like Steve from Birmingham are worried they're at heightened risk of infection, but say they can't afford not to work.
You can come out and do an 8-hour shift and you'd be lucky to take £40–50 home before deducting expenses. We're unsure of how we're going to pay our bills, how I'm going to pay my rent this month, and it's very disturbing.
Companies like Uber and Deliveroo have hardship funds for those diagnosed with the virus or told to self-isolate.
Bye-bye, guys.
But workers need documentation to prove it before they get any cash. Unions are calling for emergency measures from the government to help millions of workers in the gig economy and the self-employed. Those who aren't entitled to sick pay have been told they can claim benefits quickly, but that money could still take weeks to come through, and many don't have a safety net.
Approach to this issue, the issue of sick pay, has been piecemeal. It's also shown us about the close proximity of work to health and the importance of focusing on health as the kind of ultimate goal, if you like, for not just individuals but also the economy.
Leanne is self-isolating. She works as a carer and is entitled to sick pay of £94.25 a week.
I'm going to plunge deeply.
But as a renter on low pay, that won't go very far.
I'm really stressed. So I kind of gone to anger to fear, I think. You know, people in my position, I think if you've got no savings, you've got no backup, what is going to happen to us?
And when it comes to businesses, some are confused about how to access new government grants. Many cafes, like this one in Salford, are trying to adapt.
Now we're looking at contingency plans, what can we get in place for deliveries or more takeaway services. But we as a business, we're an independent company, we can't afford to close.
For workers on the lowest pay and many small companies, this is fast becoming an economic emergency. Sarah Corker, BBC News in Manchester.
It's emerged tonight that the armed forces have been told to be on an operational footing by mid-April to help deal with the crisis. Our defence correspondent Jonathan Beale is in Whitehall for us. And that means what, Jonathan?
Well, this is a message we've obtained from the head of the armed forces, General Sir Nick Carter, to senior military leaders, essentially a call to arms, putting them on a campaign footing, saying they're not just going to have to do their normal job of protecting the nation, but fighting this virus for the nation too. Now, we know that 20,000 military personnel are on standby to help civil authorities. Here he gives more details. He says, for example, they may have to help in the organisation of temporary hospitals and other medical facilities. He also makes clear this is going to be for some months ahead. He says we are to be prepared for our collective posture to be on an operational footing by mid-April, recognising this could endure for 6 months or so. And he ends with this rallying cry. This is a time for the leaders to step up and deliver. We need to be prepared to fight the war we may have to fight. And it is now clear, he says, that moment has arrived.
Jonathan Beale, thank you. Well, young people are being warned not to be complacent about the coronavirus. England's Chief Medical Officer, Professor Chris Whitty, said the vast majority of people in all age groups would recover, but it was a mistake for young people who are healthy to think they would all just breeze through the pandemic. Meanwhile, doctors and nurses working on the front line are calling for NHS staff who have symptoms to be tested quickly so they can return to work. Our health editor Hugh Pym reports.
Just your blood pressure.
A patient who's coughing sees a GP at the Bridgewater surgery in Watford. It's a specially organised service for patients with respiratory problems on a different floor to the rest of the practice.
This may or may not be coronavirus. We can't say for certain because you've got underlying asthma.
The GP sends her on to hospital to decide whether a test is needed. Many doctors and nurses say they want testing for themselves, so if they have to isolate at home and then test negative, they can return to work.
We're very much on a war footing at the moment.
Alan is an emergency care doctor who's frustrated that testing isn't readily available.
For a lot of people, not being tested means they're getting hit by a compulsory time off work, and that leaves a lot of stress for them and a lot of stress for the workforce still in work.
It's an issue I put to the government's chief medical advisor.
How quickly can you roll out more testing for NHS staff who feel they want to be reassured that they might be able to come back to work or be at work?
For the NHS, the ability to test their staff, our staff, I'm an NHS worker myself, when people are actually unwell and self-isolating, particularly if they've got mild symptoms that mean that they could normally go back to work, is absolutely critical.
The Welsh Government has started testing for NHS staff. In England, the NHS has announced an increase to 25,000 tests a day for hospital patients. As if NHS workers didn't have enough to worry about, they're confronted by this after a tiring shift.
There's no fruit, there's no vegetables. I just don't know how I'm supposed to stay healthy. And those people, when people are just stripping the shelves of basic foods, you just need to stop it, because it's people like me that are going to be looking after you.
For those younger people who are continuing their social lives as normal, there was a stern message. They may be less vulnerable than others, but they must still follow the guidelines.
The mixing in pubs and restaurants and so on that we've said is a really part of allowing the disease to spread needs to stop. And it needs to stop amongst young people as well as older people.
Tamor, who's 30, has contracted the virus.
Please think about where you're going, who you're mixing with, and the impact it might have on you, because it can lead to you getting this virus, which is quite painful, it's quite difficult to manage, and it takes everything out of you.
Most people who get the virus won't feel many symptoms. The worry is for those, whatever their age, who become the sickest. Hugh Pym, BBC News.
Pupils will get more detail tomorrow about how their GCSE and A-level results will be awarded after this year's exams were cancelled. The Education Secretary in England, Gavin Williamson, said he would do everything he could to ensure that grades would be available in August. It was confirmed today that school exams won't take place in Scotland either. Instead, qualifications will be awarded on the basis of coursework, teacher assessments and mock exams. Here's our education editor, Bronwyn Jeffries.
In just a day, their life has changed. Yesterday, exams to win their A-level grades. Now instead, coursework, predicted grades and teacher assessment are likely. Today, Majda and Ewan were struggling to take it in.
It's definitely very upsetting because I've been in the school for 7 years and this might be my last day in the school, or tomorrow might be my last day, so I might not see any of these people, any of my teachers ever again, and that does make me sad.
It was almost like a shock, but I kind of expected it to happen. I just felt like a lot of my hard work had been sort of not put to waste, but it just feels like it's so uncertain what's going to happen.
After years of studying for exams, having them just cancelled has left many teenagers with a massive sense of anticlimax. And they're not just missing exams, they're also missing out on saying goodbye to their school friends and goodbye to their school.
We're keeping in touch with students every week.
Head teachers are working out who they will let in, vulnerable children and those of key workers. Sorting out exam grades will have to wait.
I think there is an issue around examinations, and I think we will deal with that, but actually that's probably not the priority over the next 2 or 3 weeks. I think it's about the safety of young people, it's about the safety of our fellow citizens in the nation. It is a national crisis, and I think all of us have to step up and do what we can.
Around the UK, families are adjusting.
We'll have to make sure we haven't got parents who can help out because both our parents are elderly.
Months without the backup of schools.
My work's let me work from home, so I'm going to work from home some days and then go into work other days and set up a wee school in the house.
She's setting up a school.
Children saying goodbye to friends for now.
Bit sad, honestly, because, maybe the last time I'm here, so.
Sally is a primary teacher. She intends to go on working as best she can, knowing it will help others doing life-saving work.
Obviously, my mum is in the very at-risk category, and I want all the NHS workers to still keep going to work.
How much has changed for them? No exams, no proms, no celebration of results. Bronwyn Jeffries, BBC News.
Well, we've been inundated with questions about schools closing and exams being cancelled. Sophie Hutchinson has been trying to answer some of them for you.
Hello, I'm a young and healthy primary school teacher and I'm happy to come into school. But what about older staff and staff who have children at home, as well as staff who have families that might be at risk? What's the advice for them?
Well, that's something to be worked out by each school and each individual teacher. Can they stay on in the classroom? And how many pupils do they need to accommodate from vulnerable families or with key worker parents?
I'm a single parent who works full-time and both my parents work full-time. I've got absolutely no childcare in place for my child at the moment because in the summer holidays he would normally go to a holiday camp, which would subsequently are now closed too. If I have to take 6 weeks off work, where do I get the money to pay my bills from?
Well, it's a very tough situation and one that many people are facing. If you have any paid holiday that you could use, that might help. Otherwise, the local council might have a hardship fund and you could ask for some bills to be paused, but they will have to be paid eventually.
Is a child whose only decent daily meal, a school dinner, classed as vulnerable?
Well, children who are entitled to free school meals will be given food vouchers that they can spend in local shops and supermarkets, or some schools may continue to provide meals.
From next week, when all the schools are closed, is it possible to carry on school classes by webinar?
Well, some schools may have clever technology that allows them to create virtual classrooms, but the vast majority are expected to put more learning activities on their websites and information for parents, and also give pupils books and print-offs to take home.
And you can keep up to date with plenty more questions and answers and all the latest developments about the coronavirus outbreak on the BBC News app and on our website.